Welcome to our webinar today, November 18th, 2020. And this is a co-hosted webinar, and we're really pleased to be able to do this with our partner and our collaborator, the National Collaborating Center for Infectious Diseases, and I'm from the National Collaborating Center for Determinants of Health. And the title is Measure What Counts in the Midst of COVID-19 Pandemic, Equity Indicators for Public Health. So we have three speakers today, and I'm going to actually ask each of them to just say a brief introduction of themselves in about a couple of seconds here. And I'm going to begin with Margaret, then move to Dr. Yasmin Khan, and then I'll introduce myself. While we're introducing ourselves, we'll also acknowledge the land that we're working on and moving on. So Margaret, first to you.
Thank you, Claire. My name is Margaret Haworth-Brockman. I'm the Senior Program Manager at the National Collaborating Center for Infectious Diseases. NCCID is located at the University of Manitoba on the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. We respect the treaties that were made on these territories, and we acknowledge the harms and mistakes of the past, dedicating ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. NCCID has a comprehensive program of knowledge translation for public health in the area of infectious diseases, but very important to us is where are the inequities and how can they be resolved? What can public health do, and how can public health interact with other sectors? So this project and this presentation is very much representative of our work at NCCID.
Thank you, Margaret. That's great. And Dr. Yasmin Khan is our special guest today. And so Yasmin, I'm going to ask you to introduce yourself.
Thanks, Claire. My name is Yasmin Khan. I am an assistant professor in the Division of Emergency Medicine, the Department of Medicine at the University of Toronto. I am an emergency preparedness physician at Public Health Ontario, and also an emergency physician at the University Health Network in Toronto. And I would like to acknowledge the lands that my presentation is going to be delivered from, the traditional territory of many First Nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. I also recognize the enduring presence of many diverse First Nations, Inuit, and Métis people across the regions to which this webinar is being delivered.
Yes, and I'm Claire Betker, and I am the Scientific Director at the National Collaborating Center for Determinants of Health. I'm actually sitting in the same place and territory, so thank you, Margaret, for that eloquent acknowledgement of the land in and around Winnipeg, Manitoba. The National Collaborating Center for Determinants of Health is located in Antigonish, Nova Scotia, which is in the Mi'kmaq area, and that's the ancestral and unceded territory of the Mi'kmaq people. And this territory is covered by the treaties of peace and friendship, which the Mi'kmaq and the Maliseet peoples first signed with the British Crown in 1725. And the treaties did not deal with surrender of lands and resources, but in fact recognized the Mi'kmaq and the Maliseet title and established the rules for what was going to be and what is an ongoing relationship between nations. So thank you for that. So this is an outline of our presentation, and we have more than 100 people here today, which just is amazing. And before I get going in the outline, I just really want to extend our collective thanks for all that you're doing in this very serious and people use the word unprecedented, but this unprecedented situation that we all find ourselves in professionally and personally. So thank you so much for all the work that you're doing and all the effort that you're making on our behalf. So today, our outline for this webinar is to just highlight what the National Collaborating Center for Public Health program is about, very briefly, I'll tell you about the project phases that we are in. We're actually in the third phase right now. The methods that we used. And then I'm going to ask Yasmin Khan to speak to some, I think, some pretty incredible research that she and a number of very esteemed colleagues of hers did, and she'll talk to a framework and a set of indicators. Then Margaret's going to take over and speak to you about the equity prompts for those indicators that were an outcome of our project together, our collaborative project, with some considerations, and then we really, really want to hear from you. So this is the map showing the locations of the 6 collaborating centers, the National Collaborating Centers for Public Health, and you can see the one for determinants of health is in Antigonish, Nova Scotia, for infectious diseases in Winnipeg, Manitoba. The one for healthy public policy is in Quebec. The one for methods and tools is in Ontario, in Hamilton, Ontario. For Indigenous health is up in northern BC, and for environmental health is in southern BC. So for those of you who don't know, this is our collective mandate as a set of centers, is to promote and support the use of scientific research as well as other knowledge to strengthen public health practice, public health programs, and public health policies in Canada. We're each hosted by an academic institution or a government, and we each have a focus, as I just said, on a specific public health priority. And there's a link there to a 2020 article written about the NCCDH program. And what's interesting is that we were created in the wake of SARS, so I think we have a very important role in terms of our efforts around COVID-19, the pandemic, both planning, response, as well as recovery.